Hey there. When you need to relieve pain and fever, one of the most trusted medications you can reach for is Panadol, which contains the active ingredient paracetamol, also known as acetaminophen in the US. This medication is available worldwide as a generic and brand name. In this video, I will tell you all about paracetamol or Panadol, including how it works, when to take it, and when it's not necessary. Let's get into it. Very Well Health paracetamol is part of a group of drugs known as analgesics, which are substances that relieve pain. It is also classified as an antipyretic, which means it reduces fever. In addition to treating headaches, muscle aches, and fever from colds or immune. Paracetamol is also useful for period cramps and other types of mild to moderate pain. Paracetamol is considered a safe and effective over-the-counter pain reliever and fever reducer when used appropriately. It has a relatively low risk of side effects compared to some other pain medications, especially non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or naproxen. Now, before we continue, please take a moment to subscribe to my channel. If you find my videos helpful, please consider supporting me through the provided means. Your support is greatly appreciated. How does it work? Paracetamol has several proposed mechanisms of action, meaning it works in different ways to relieve pain and reduce fever. 1. Inhibition of prostaglandin production. One way it works is by reducing prostaglandin synthesis. Prostaglandins are chemicals that are involved in the transmission of pain signals and also promote inflammation. Paracetamol inhibits two enzymes responsible for making prostaglandins, known as COX-1 and COX-2, particularly in the brain. It has a greater effect on the central nervous system mechanisms than on prostaglandins. However, when levels of arachidonic acid or peroxides are low, paracetamol's effects are mainly due to inhibition of these enzymes. PubMed News. Medical Wikipedia. 2. Central brain mechanisms. Another way paracetamol works is centrally in the brain by activating descending serotonergic pathways, which are pain-blocking pathways that travel from the brain to the spinal cord. By activating these pathways, paracetamol can help to reduce the perception of pain. PubMed Wiley Online Library. 3. The AM404 pathway. Endocannabinoid related. In addition to its other mechanisms, paracetamol also works via another pathway involving a metabolite of paracetamol in the brain. This metabolite, called AM404, influences the endocannabinoid system and TRPV1 receptors, which are involved in the transmission of pain signals. By modulating these systems, AM404 can help to relieve pain. Wikipedia, Dove Medical Press. When and how to take it, adults. Dosing information. When you take Panadol, make sure to follow the instructions on the label or as directed by your doctor or pharmacist. Generally, adults should take 500 to 1,000 milligrams every 4 to 6 hours as needed. The maximum recommended dose is 4,000 milligrams per 24 hours, which is 8 500 milligrams tablets. Therapeutic Goods Administration, TGA, NHS, UK, NHS inform. Please note that these are just general guidelines and your specific dose may depend on the formulation of paracetamol you are taking. Some formulations have different dosing recommendations. Also, if you're experiencing ongoing or persistent pain, it is essential to consult a healthcare professional as it might indicate an underlying medical condition that requires treatment. Furthermore, for sustained release formulations of Paracetamol, such as those used for osteoarthritis, the dosage may be different and may be taken every 8 hours. Important warnings. Avoid taking multiple products containing paracetamol at once, as this can increase the risk of overdose. Paracetamol overdose can cause severe damage to the liver and can be fatal. Therefore, it is crucial to read the labels of all the medications and products you retaking to avoid accidentally doubling up on Paracetamol. Health Direct NHS, UKDrugs.com, NHS, Inform HSE. When is it necessary? Kabzarori. Hi! Paracetamol is particularly useful when you have mild to moderate pain or fever that is uncomfortable or interfering with daily tasks. Acetaminophen is generally safer than NSAIDs for those who drink alcohol regularly, have sensitive stomachs, or cannot tolerate NSAIDs. However, please be cautious if you have kidney or liver disease. Very well health news, medicaldrugs.com. Be cautious with. Although generally safe when used as directed, there are a few things to be cautious of. 1. Long-term or frequent use. Long-term or frequent use of paracetamol may be associated with an increased risk of high blood pressure, peptic ulcers, and heart failure. 2. Risk of bleeding. Paracetamol may increase the risk of bleeding, especially in older adults or those with other conditions that affect blood clotting or have a history of stomach ulcers or bleeding. The sun, +1. There is also potential negative effects on heart function. Animal studies show that high doses of acetaminophen may affect heart function, but more human studies are needed to confirm these findings. The sun. As with any medication, always use the lowest effective dose, only take it as needed, and for the shortest possible time. That's all for today's video. Thank you for watching. Please like and share if you found it helpful, and stay tuned for more health videos. Stay healthy and take care. Bye.